Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the COVID-19 pandemic in the state of Maryland, across the USA, and also at GBMC. So many of you heard the governor last week at his news conference give us the first information regarding contact tracing. What is contact tracing? Well, now when you have a positive COVID-19 test, you may be contacted by state representatives or local representatives who ask you questions about how you may have contacted COVID-19 and about who you may have transmitted the disease to. Well, this fairly startling news was that the most commonly reported opportunity for having gotten the virus was not from a large gathering at the beach with people that we don't know, but was with family members. When you think about this, it is human nature to believe that we are more at risk from people we don't know than people who we know. But if we pause and think about that, if we're talking about extended family members, those extended family members may be having the very same exposures that people that we don't know have. And since we have been more afraid about people who we don't know, it is more likely that we have spent more time with people who we do know. So I'm going to talk about the GBMC situation in a minute, but the take-home message from the governor's contact tracing information is that we should probably be wearing masks and staying 6 feet away from family members as well. Now, obviously, if it's your spouse and you're sharing the same bed with your spouse, it doesn't make a lot of sense to be wearing a mask. But if you're going to have a family gathering, try to keep it outside. It is harder out of doors to transmit the virus. When you're having the family gathering, try to keep the most at-risk people away from others. You may want to have grandmother and grandfather set aside a little further away from the group and clearly wearing their masks. You want everybody to wear a mask when they are within 6 feet of others. And please, please make sure that everybody washes their hands, especially before they're going to eat, because it is in touching their face and getting their hands close to their eyes that they may be catching the virus. So thank you for washing your hands frequently, maintaining 6 feet distance, and wearing your mask, and considering doing that also when you are around family members and people you know, because you may have a false sense of security around those folks, and they may have the disease, not be symptomatic, and therefore able to transmit it to you. So what's happening at GBMC now? Well, the situation really has not changed that much. Right now, as we speak, we have 15 COVID-19 positive patients in the hospital and another 17 patients for whom we are awaiting test results. Our emergency department volume is back up to an average of 100 patients per day, still 35 short of where we were pre-COVID, but many, many people are now coming back for help, and not just people who are concerned that they may have or are sick with COVID-19. So we are grateful for people coming to get the help that they need. Please keep it up. There is one change in what we're seeing in the state of Maryland and at GBMC, and that is, although we've had a bump up in the number of patients going to regular inpatient beds in Maryland hospitals, we have not seen the bump up of the number of intensive care unit patients. Experts have been thinking about the why for this, and they've concluded that we are getting better at treating people with COVID-19. We still don't have a cure, but the use of steroids and remdesivir appears to be keeping patients' degree of illness down such that many more, yes, they are getting sick enough to require hospitalization, but they're getting better and going home rather than escalating their severity and moving on to the intensive care unit. So let me end where I always end. I want to say thank you to all of the healthcare providers, not just at GBMC. It's now been many months since they've been standing up to COVID-19, and we all need to be grateful to them. And I also want to thank all of you in the community. Please do the social distancing, wash your hands, and wear your masks. The fall is upon us. What will the fall bring? There is no biologic reason for there to be another surge just because it is the fall. If there is another surge in the fall, it will be because we have gathered back more tightly connected to each other. We will be less likely to be out of doors, more likely to be indoors, and with us more likely to be indoors comes a greater risk of exposure. So please keep your guard up, especially around people you know in your neighborhood and even in your home. Thank you very much. Be safe. We are here for you if you need us at GBMC.